artery disease, also called as the CAD, is a condition that affects our heart. It is the most common heart disease, and it happens when the coronary arteries struggle to supply the heart with enough blood, oxygen, or even the necessary nutrients. Cholesterol deposits, or the plaques as we all know it, are almost always to blame. Prior studies have demonstrated that cardiovascular event rates and risks of invasive procedures are inversely proportional to kidney function. As such, kidney function often influences the treatment strategies. Moreover, patients with an impaired kidney function generally exhibit lower rates of medication adherence and are less likely to achieve any medical therapy target. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about the clinical and quality of life outcomes following the invasive versus the conservative treatment of patients with chronic coronary disease across the spectrum of kidney function. The findings published in the JAMA network come from an analysis which aimed to evaluate the clinical as well as the quality of life outcomes across the spectrum of chronic kidney disease patients following a conservative and an invasive treatment strategy. Now, participants from the International Study of Comparative Health Effectiveness with Medical and Invasive Approaches, which is the ischemia, and the ischemia chronic kidney disease trials were categorized by their CKD stage. They were categorized as stage 1, stage 2, 3, 4, or even the stage 5. There was a monotonic increase in the risk of the primary composite endpoint, death, cardiovascular death, myocardial infarction, and stroke in individuals with a higher CKD stages. The invasive management was associated with an increase in stroke and procedural MI and a decrease in the spontaneous MI with no difference in various other outcomes. The effect was similar across the CKD stages. There was also heterogeneity that was noted of the treatment that affected the quality of life outcomes, such that the invasive management was associated with an improvement in the angina-related quality of life in individuals with CKD stages 1 to 3 and not in those with stages 4 to 5. The authors thus concluded that among participants with chronic coronary disease, invasive management was associated with an increase in stroke and procedural MI and a reduced risk in spontaneous MI, and the effect was similar across the CKD stages with no differences in other outcomes, even including death. All this meaning that the benefit for the quality of life with invasive management was not observed in individuals with poorer kidney function. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.